Hi, back again to do another quick video to help you guys sort through nutrient deficiencies and trichotillomania and other body-focused repetitive behaviours. If you don't know me, my name is Laura Schulz. I'm a clinical nutritionist and I specialise in the hair pulling disorder trichotillomania and other body-focused repetitive behaviours. You can probably tell by my accent that I am Australian, and I treat a lot of people with trich. So I just started doing these videos, and today we're going to be talking about vitamin D deficiency. So really important, and you probably think the fact that we live in Australia that the majority of us are not vitamin D deficient, but I can tell you that a lot of us are. So in the top part of the country is definitely where it's a lot warmer, and even those living there, I definitely see vitamin D deficiency. So I do have a few slides for you, so I'm just going to pop them up now. Yeah, so that's just a little bit about me. If you don't know me, so yeah, clinical nutritionist, and I've had trich myself for 28 years, and I've used nutrient therapy and correcting nutrient deficiencies to overcome the disorder myself. So this is me teaching others how to do it as well. So what does a vitamin D deficiency have to do with mental health and trichotillomania? So a lot of you might know, but you may not know that vitamin D, usually we see low levels of vitamin D when it comes to depression, low moods, anxiety. So there is some evidence to suggest that the main psychophysiological aspects related to vitamin D levels are in fact symptoms of depression. So there's definitely evidence for that, but followed by traits of obsessive compulsive and panic disorders and or anxiety. So, and that's where, that umbrella of OCD where trichotillomania comes in. And that's why there's not a lot of studies when it comes to trich and vitamin D linking together, but there is for OCD, there is for depression, there is for anxiety. So it's me just bridging those topics together. And, I've definitely seen low levels of vitamin D in my clients. And when we're able to lift them, we definitely see improvements with reduction in urges, that sort of thing. So that's a really good question. So have you ever noticed, and I feel like there are people out there that have noticed this, is have you ever noticed during the winter months, is your pulling urges worse? So a lot of us have that sort of seasonal mood swings where we start to feel a little bit low and down. And that's often when we start to have more urges to pull or, get into that sort of depression. And often it's because, not just because, but often it is a factor that vitamin D levels are low during winter. Most of you might know is that vitamin D, they call it the sunshine vitamin. We get it from the sun, so we're going to go through that in the video. So other signs of low vitamin D levels are fatigue, so just feeling tired, low energy, sleep disturbances. So often when I see people having issues with sleep, I'll look at vitamin D levels, and I also look at iron levels. That's a little tip for you. Bone pain or aches, so vitamin D has a lot to do with bone formation, so vitamin D and calcium work together when it comes to bone health. So often the doctor will prescribe a vitamin D test, like blood test, if there's bone pain or aches or things like that. Hair loss, so obviously an important one for us. So, obviously we're pulling it out, but we can actually have more hair loss, just it coming out on its own when we're low in vitamin D. That's also another thing when it comes to iron and B12 and folate, but that'll be future videos. Muscle weakness is another one. Depression and low moods, which we've already said, a loss of appetite, pale skin, and immune dysfunction. So immune system, it's huge for immune function when it comes to vitamin D. So, we're always getting sick during winter. That's another factor, is just, being those low vitamin D levels, we just don't have that immune system, functioning the way that we want to. So we might get sick a little bit more often if our vitamin D levels are low. So I wanted to mention vitamin D blood tests. So I've mentioned in previous tests about in previous videos, sorry, about reference ranges before and about absence of disease and optimal levels. So absence of disease is the reference ranges that the doctors use or the pathology labs use. And as you can see there, so 50 to 200 when it comes to the nanomoles per litre. That's what we use in Australia. In America, they use nanograms per milliliter. And so the absence of disease, as you can see, is 50 to 200, whereas when I'm looking at blood tests, I like to look at optimal levels. So as you can see, the upper level is still 200, but we want it in that top half of that reference range. So above 100, even better if it's above 120. So, and when we're looking at nanograms, it's over 48. I usually like it around in the 50 to 60 mark when it comes to that. So if you want to check your vitamin D latest blood test, that's what I would be looking for. So as I mentioned before, only use it requested if there's bone problems. But yeah, a 2021 study suggested, so only a fairly recent study, that 50% of the world population is vitamin D deficient. So that's pretty huge to me. I know iron is another one. It's like 30% of the world's population. So it's huge. These deficiencies are huge, and I think they're really impacting our mental health. And I do really believe that it's impacting when it comes to, you know, things like body-focused repetitive behaviours, irritability, low moods, depression, mental health, ASD, ADHD. I just, firmly believe that this is all linked, and we need to look at the whole body, not just medication and things like that. So I've just written on here also, so low vitamin D levels are also linked with a risk of cancer, cardiovascular disease, diabetes, and liver disease, because I just want people to know that, you know, it's not just about the mental health picture. It is overall health. Like, we need vitamin D for quite a few things. So, so I just wanted to mention here, so how do we actually absorb vitamin D? So most of us know that we get it from the sun. But what most of you might not know is that we need to get it from the ultraviolet B rays, so the UVB. And generally, the UVB rays is like 5% of what we get. So 95% of the day we're getting UVA rays, and for like 5% of the day it's like UVB rays, which is that middle part of the day. And I know skin cancer clinics and skin cancer campaigns have been, don't go out in the sun in the middle of the day, or slap on sunscreen or a hat or whatever, but that's definitely that middle part of the day. We only really need like 10 to 15 minutes. If you've got darker skin, you might need a little bit longer, but that's all we need in the middle of the day. So if we're in office all day, or sitting at home all day, or not out in the sun in that middle of the day, you're probably not getting enough vitamin D. So kidney health is also really important for the absorption. So the kidneys are what convert vitamin D from supplements or the sun to the active form. So we talk about vitamin D2 versus vitamin D3. So we've got to convert that D2 to D3. You might have seen that on supplements before. And the presence of fat. So vitamin D is actually a fat-soluble vitamin, along with vitamin A, E, and K, and they all work together. So dietary fats and those other fat-soluble vitamins, they work together to be absorbed together in the intestine. So if we don't have those, we're not going to be absorbing it as well. And another thing is that I really wanted to mention, because I do have a lot of my clients on magnesium as well, is adequate levels of magnesium. So if I see a vitamin D deficiency, there's usually a magnesium deficiency. Not always, but I don't usually look at magnesium blood tests. I prefer to look at a liver function test, because that can tell me a little bit more about the magnesium that's actually in the cells and what's happening for that. But that will probably be another future video. I could talk about this stuff all day. So vitamin D depletion. So what causes if we're vitamin D depleted? Like, why are we such low levels? So I've already mentioned here, so limited sun exposure. So if we're not getting that UVB rays in the middle of the day, then we're probably not getting enough sun, not enough of the right sun. So some medications can actually deplete vitamin D levels. So cholesterol lowering drugs, laxatives, and steroids. There are others, but they were the main ones that I wanted to that I wanted to bring up here. As I mentioned before, so malabsorption in the gut. So we need that dietary fat or the other fat-soluble vitamins to help absorb and to get it in. But the other things that you think of, any other things that are inflaming the gut, that's also going to stop that absorption. So think celiac disease, IBS, so your irritable bowel syndrome, Crohn's is another one, and just inflammation in general, like that's a whole other video as well. But inflammation in general, I talk a lot about inflammation in the body, and I do believe that when it comes to Trich, it's a lot of lowering that inflammation, correcting those nutrient deficiencies to really get some traction and get those urges really reduced and just find that calmness and that homeostasis in the body. So I always say gut inflammation or inflammation equals brain inflammation. I often use that with my clients and my course members. So as I mentioned before, magnesium deficiency, but the other two that I'd like to mention, I did mention already, vitamin K. You'll often see supplements will have vitamin D and vitamin K. That's because they work synergistically together and can absorb together. And the other thing that I often see is zinc. So a zinc deficiency can also coincide with a vitamin D deficiency. So that's something else I like to look at if there is a vitamin D deficiency. So how else can we get vitamin D? So I wanted to add this one in. I didn't want to leave you hanging and not working out, well, what do I do then if I am, too low? Is so foods. So when we look at vitamin D in foods, it is in some foods, but really it only probably makes up 10% of the way we absorb vitamin D. Really 90% of it has to come from the sun. It's pretty low levels when it comes in these foods. So fish can come in fish, so salmon, tuna, oysters, sardines, herring. There's more, but I've just limited what's on these slides. Eggs is another one. Dairy products, those are usually inflammatory foods as well. So I wouldn't necessarily want you to get vitamin D from dairy products, but I thought it was worth mentioning. And fortified products. So you might find it in your cereal, your bread, your milk. You have a look at a packet next time you're using any of those, and you might find fortified with vitamin D. So so it might be in one of those. I also wanted to touch on supplementation, because I don't want you to just watch this video and go, I need to start taking a vitamin D supplement. I just think it's nice to know other factors that are, and what to look for when it comes to vitamin D supplementation. So I did mention before about vitamin D2 versus vitamin D3. So D2 is basically the plant-based, D3 is like the activated animal base. So if you're vegan or vegetarian, you might more so want the D2, and then we rely on our body to convert it, or we'll go straight to the activated form, which is vitamin D3. It means the body doesn't have to do much. We're taking it in the active form. So it's definitely the most absorbable form of vitamin D is the D3. How many IU? So IU is your international units. If you see your vitamin D supplement or a supplement on the shelf, they're usually in international units. It can come anywhere from 1,000 IU to even 10,000 IU. And I even know some doctors, when they've been really low in vitamin D, I've had a few clients in Canada and America that have been extremely low, where the doctor's actually given them injections of 50,000 IU. So it is a hormone, so we don't want to be taking too much. I'm always of the case of low and slow, like, steady wins the race. But you need to so the other factors we need to take into account is your lifestyle. Like, how often are you getting sun? Is it winter or summer? What are your levels, your current levels now? I think it's important to get a blood test at least once a year. So you've got to take in a lot of factors. So even though I know during winter, so just as an example, if it was winter time, I would probably be taking up to 4,000 to 5,000 IU a day. I think that's what we would probably need to keep those levels stable, depending on what your levels are and if you are still getting sun. There's definitely no harm in doing that, probably 5,000 to 10,000, but I wouldn't do it long term. And if you're getting enough sun, like during summer, I definitely wouldn't recommend supplementation. So, but it might be a factor of, getting more dietary fats in to make sure that you're absorbing it, or making sure you're getting 5 or 10 minutes just without sunscreen or a hat, or making sure we're exposing. So this part here of our arm, you know, sometimes we're going outside and we're completely covered up and we're not actually exposing our skin to any vitamin D. So it can be just about, you know, being aware and knowing how to increase our vitamin D levels. So that's it for me today. I hope you enjoyed the video. If you did, please like it or share it with others in some other trick groups or other people that you might know that, you know, might find this video handy. And feel free to subscribe if you want to get notifications about my new videos for Tricky Nutrition. So, and you can also find me at Tricky Nutrition on Instagram and Facebook. So come over there, and I share a lot more resources over there. And I'd love to see you soon. So thanks for joining me today. Bye for now.